So today we have Dr. Rob Silver, who is an amazing, I believe he's a researcher and no longer practices veterinary medicine one-on-one, but now makes an impact in the veterinarian community so it can touch more animals on a larger scale. So Dr. Rob, welcome to the Cancer-Free Canine Facebook event page. Thank you for joining us.
Thank you, Poppy. I'm really happy to be here tonight.
It's awesome having you. I know you're very busy. I'm happy to be on your dance card. And
yeah, not too busy for something like this. This is great stuff. Reach more people, get a good message out there.
Well, and it's a big passion for me. So the way it started for me is I'm the youngest out of 6. I'm daughter number 5. So we 5 girls, 1 boy. Every single daughter in my family has come down with cancer, except for me. So I started diving into cancer research for my own preventative benefit. Being the youngest, I was like, I am not going down this road that my sisters went down. So I started to pursue cancer research for myself and then started seeing dogs in my practice. I was originally a horse person and had equine alternatives, and then created Holistic Animal Insights because I started seeing cancer dogs and having success with it, implementing what humans do for themselves. So with that knowledge, this Facebook group got created and I get to interview awesome guests like you. So this is really cool. So we want to know everything you know about canine cancer and the nature's arsenal that's backing you. I know you are a passionate researcher and you've dove into some medicinal herbal remedies. You've actually taught for the Chi Institute. You're a guest speaker at the AVMA, right? Or the AHVMA?
Both, actually.
That's amazing. That's amazing. That's a win right there that you're a guest speaker at the AVMA.
Well, it is. I wish my lectures were better attended. They were well attended, but there's a lot of veterinarians just don't have this on their dashboard. It's something that they're interested in, integrative medicine and and alternative approaches to treating some of these serious diseases that we see in our pets. For myself, I'm much like you, in that although I don't have 5 sisters, and we don't really have cancer big in the family, but I've watched friends, I've watched pets, I've watched relatives pass away from cancer, and in practice, I just had so many patients come in with cancer, especially once I started hanging my shingle out as an integrative holistic practitioner. It seems like that really brings them in, and so you have to figure out how to treat these poor guys because so many of their problems are just so serious and life-threatening and can be very costly to treat, and some of the treatments that we do, the surgical treatments, are very disfiguring and there's no success for them. So I just wanted to know if there were things that we could use instead of these conventional treatments, or perhaps the conventional treatments weren't bad, they just needed a little help, to reduce some of the adverse side effects that we might see and improve their ability to improve outcomes. And so that's kind of where I started, was in practice. And I soon found that there was really not a lot of information out there about cancer in pets in any kind of way that would talk about what kinds of supplements, what kinds of diet to use. I mean, even now, if you read some stuff by conventional nutritionists, they say there is no such thing as a cancer diet, and then they quote statistics and things, even though we know that with cancer cells aren't the same as healthy cells. They have a different metabolism. They find that too much oxygen with a cancer cell is toxic, and they don't utilize fats for energy, and they mainly just use carbohydrates and protein a little bit. So it makes sense, and so many commercial foods, especially the kibbles, have so much carbohydrate in them, and they're so processed. They've got all those they call them Maillard reaction products, which happen when the protein and the carbohydrates in the food are cooked under high pressure and high temperatures. It changes their molecular structure, turns them into toxins, many of them. So, and they're not, it's not hugely toxic. It's small toxins that you take in every day that over time have a pretty deleterious effect on your health. So, so it's surprising because to feed a dog who has cancer, you don't want to feed a lot of carbohydrates. You want to feed more protein, and really, to be ideal, you want to feed more fats. That's kind of where the idea behind the ketogenic diet comes in, which is to change the metabolism of the body so that the energy that is produced from food doesn't feed the cancer, but feeds the body. And so I think, and when I did my cancer consults in practice, I gave an hour and a half worth of time for me to examine the animal, but also to talk to the pet parent, to find out what their goals were, what was their background. Some of them came from backgrounds very similar to yours, where, they had lost family members to cancer. They had seen the ravages of chemotherapy and radiation and didn't want that for their pet. They didn't want amputation. They just wanted to have either a peaceful, graceful ending, or they wanted to end it as soon as possible. And so that's a pretty high bar to raise there. And when these are, just really can be very challenging patients to work with in terms of the problems. So that's kind of where I got my start. I started with diet. I wanted early on to be holistic, but there were so few training programs back then. There were no training programs back then. So I started reading Dr. Pitcairn's Natural Health for Dogs and Cats that had a diet in it. The first thing I did was suggest that diet. And I started to see great results from a diet that actually was 50% carbohydrates, but still we had great results because there's a world of difference between processed foods and fresh, wholesome foods. And there's just so many more micronutrients and so much more available nutrition and so much more moisture that our pets just do so much better, with real food, so.
I think that's really interesting that you went from kibble to not all raw or all fresh, but just making that transition was enough to move the needle in these dogs.
I was reluctant to go raw because of all of the brainwashing that I'd had as a vet about foodborne pathogens and everything else. Of course, I would talk to some of my veterinary friends who were, who grew up on farms, and they'd say, have you seen what dogs eat, on a farm? Have you seen them eat the afterbirth, and you're worried about raw meat? So it took me a while to go raw, and it took me a while to learn more about the value of the nutrient profiles that, you can manipulate how much carbohydrates and how much protein, and how much fats and the vegetable fraction to match the exact needs of that individual patient, versus just giving them a standard diet. And for a cancer patient, their nutritional needs are different, because the cancer is depleting their body of nutrients, and their cancer is also creating toxins. It puts an extra burden, on the liver. And so you have to be aware of that and use nutrients that are going to be helpful, but then you also need to look at supplements that are going to help to enhance the function of those organs.
Now, when I worked with my mentor, my naturopath, the one thing he really drove into me is you don't catch cancer, you create it. So you have to treat it very different, and you can't put cancer in a box, like a blood cancer to an organ cancer to a skin cancer to a bone cancer. They all behave different. They all have little different nuances and reactions. And so ketogenic might be great for one thing, but might not be so awesome for another. So knowing the exact cancer that your dog might have, or at least try to pinpoint it down, hopefully early detection is, or prevention. Prevention's the best medicine. Early detection's the next best medicine to get your dog to a safe, healthy, long, happy life with lots more memories and lots more quality of life. But Dr. Rob, in your practice, once you implemented the cleaner diet, is that what spurred you on to try alternative like herbs?
Well, as I saw animals improving, that certainly helped. But no, I was doing parallel work. You know, the diet was an easy thing. I actually had worked as a cook in a health food restaurant in the Village in New York City after I dropped out of college in the late 70s. And so I learned a lot about natural cooking then, and it was a macrobiotic restaurant, and so it was a natural thing to apply that food wisdom that I already had, you know, to my clients. But then I was in the Pikes Peak region. I'm still not far from there in Colorado, and I joined a local herb club that focused on identification of herbs, herb walks. You know, they had some edible herb and toxic herb classes and medicinal. So that's where I learned how to identify the herbs, and then and what they were for. And then I also learned how to make the medicines from the herbs, generally tinctures. I learned how to make alcohol tinctures. And so that was really helpful. And that actually was the origins, both the cooking and learning how to make herbs, herbal remedies, was the origins of what I now do a lot of, which is to formulate products for pet use. I formulated 40 products over 25 years for a company called RX Vitamins that sold their nutraceuticals, you know, strictly to veterinarians. They were very successful products. The company did very well, and they sold, and I've moved on. You know,
Hold on, I'm going to ask you a question about
Okay.
that. Did you create that vitamin D test?
I didn't create the test. We partnered with an up-and-coming laboratory, VDI Labs, and we should talk about them a little bit more, plus some other things about you talk about early detection or prevention, and we've got some blood tests now that are very accurate in determining if there is a cancer present or not.
That's so exciting.
It is, it really is. One of them they call the liquid biopsy, which they do from the blood. They can check like 24 different types of cancers with that. And then the other one is with the same lab that does the vitamin D testing. They also do you know, some cancer marker testing as well.
Why aren't we doing that more?
Well, it's just getting started. I took my dog into the vet yesterday. It's kind of a weird experience after, you know, and I'm very particular about who I take it to, and they have a long list of everything I require, and they know they better do it right. And we were talking in the exam room. He was showing me the X-rays he'd taken, and I saw they had a poster in there for the liquid biopsy, and I said, how's this? And so he's now presenting it, and he's got a very busy clinic. It's not a high-end, you know, specialty clinic, but he does a lot of high-end work there, and he also has a foundation he works with that helps with low-cost clients as well. And he was saying that it was just great, you know, that it really does give early detection. Even had a client come in just to check because they were worried. They lost their last dog to cancer, and they just wanted to check to see. It's not an inexpensive test. I said, what's the test cost, Ed? And he goes, $500. But what peace of mind. And if you really are dedicated to your pet, and if they did get cancer, you were going to, you know, do treatment, that's a drop in the bucket of what, you know, cancer costs are. I don't know if that's covered by insurance.
Yeah, early. That would be amazing. I've never had a vet offer that to
But
me.
it's brand new. It really just arose in this last year and a half. So I kind of missed out, you know, retiring from practice. I've missed out on some pretty cool things, but it's nice to know about them, and I can give them as advice to people that would be something worthwhile doing. My sister in North Carolina, she's retired. She's not doesn't have a lot of money these days, and her vet thought her cat had lymphoma or had inflammatory bowel disease, wasn't sure which one. So I worked a deal out with this lab that does the vitamin D testing because they were so happy with how much I had promoted their business. And so they gave me a nice deal on the tests for my sister's cat, and we were able to differentiate that, in fact, it was a small cell lymphoma, not an inflammatory bowel disease. And so that allowed us to treat it appropriately, manage it properly.
Now, what do you think vitamin D plays a role in cancer? Do you think there's a relationship there?
There is a relationship, but we don't yet have enough proof to say that it's causal, that a low vitamin D would cause cancer. But we know when we measure vitamin D levels in multiple cancer patients with multiple different types of cancers, and a lot of that study has been well published, we see there's a definite association that when you have a vitamin D level below 40 nanograms per milliliter, which is a pretty low amount, you have a much greater chance of having cancer, and not of contracting cancer, but all the let me reword that. The cancer patients that they measured vitamin D in all had levels that low or lower. They even can predict survival by the level of vitamin D based on these studies that they have. So vitamin D codes for over 2,000 different genes, and it's very anti-inflammatory. And what many people don't know is that dogs and cats don't convert in their skin at all. So they're strictly dependent upon their diet for their vitamin D intake. And there was a study done at Tufts where they tested, I think, 350 different dogs. Most of them were purebred dogs. They got them from breed clubs, and they were client-owned dogs. And they just did blood tests to test vitamin D levels. And then they did a questionnaire to see what they were feeding them. And they found that a lot of them had insufficient levels of vitamin D, and that there was no correlation between what they were feeding. Even dogs on the same diet had different levels of vitamin D, which means that the supplementation in the foods doesn't really address the individual need. And this is why we suggest that you early on in the life of the animal test for vitamin D and then start supplementing it, because it probably has a preventative value, especially when started early. They've used vitamin D with some allergic animals, and they found that when they use vitamin D, they can use lower doses of steroids to control the itching.
Wow.
So we know it has value. We just don't have all the pieces together, of that picture. But I think because of what we know from these studies, if you're looking to do a preventative program for your pet, I think one of the most important things would be to check their vitamin D levels and then supplement with the appropriate amount according to this VDI Labs, which is the one that does this testing.
I really want to drive home that you guys just can't take vitamin D over the counter and start throwing it to your dog. Toxicity is deadly, absolutely deadly. You need to test. You need to gauge where your vitamin D levels are at, and most of them are deficient. So yeah, my veterinarian, one of the reasons why I chose her is she tests for vitamin D. That was when I got my dog, I was like, do you test for vitamin D? Yes, I'm here. I'm coming right now. And he was terribly low. And so we put him on vitamin D, Nature's Your RX Pet brand, and he stays on that. Now, I'm sure I could also do Solgar, but we check him because he was so low. And then I did get him a tiny bit high. He gets checked every 3 to 6 months.
If that might be more frequent than you need, quite frankly, I think that it's not something that changes a lot. If you add supplements or add different things that might add more vitamin D, then you might want to change it. The reason, and vitamin D is not as toxic as many people fear. They use a synthetic vitamin D in rodenticides, in rat poison, and that stuff is deadly. But you really have to give an excessively high dosage for, 3 to 6 weeks at least every day for that to start to have an adverse effect. More important, I think, is giving the right dosage. I think for me, that's really the reason to test, is so you give the animal enough, and of course, not too much either. And we know that you can give a dose, like the appropriate level is 100 to 120 nanograms per milliliter. You can go as high as 150, no problem, and even up to 300 occasionally, and you wouldn't have a problem with that. But I think vitamin D is very important. If we're trying to build, are we trying to build a preventative program perhaps for cancer and good health in general? I think vitamin D, certainly we discussed the appropriate diet, and not everyone can do homemade themselves. Not everyone can afford, some of the frozen raw diets, and some of the more, even the premium kibbles can be pretty pricey. So, I think it's important to find the best diet that's most appropriate for that pet parent's budget, lifestyle, and, philosophy. Because some say, I just want to put the stuff in the bowl. I want to prevent cancer, but I don't want to do anything more than just dumping that kibble in the bowl, in which case that's what they do. So you have to find other means to help improve the dog's health. So diet, okay, certainly vitamin D, make sure that's good. And then gut health. I think many people believe that the gut is really the center of all of our health, because it's what curates our nutrition. It's when you think about it. I have a slide I use when I do my leaky gut talk that talks about how many tons of food a human being eats in their lifetime. I mean, tons of food. And not all of that food is nutrition. Some of it are toxins, and so our digestive system has to know what to take in and what to reject. So a healthy digestive system is really important. And that starts with prebiotics, probiotics, and postbiotics. These are all different parts of the fermentation in the bowel by microorganisms that can create a healthy health. We know this microbiome. I don't know if you've talked about it at all in any of these programs, but the microbiome is this balance of the good versus the bad bugs in the bowel. And when you have good bugs and more good bugs than bad bugs, then it promotes good health. We have microbiome in our skin. We've got microbiome in our mouth, and they're all a little different. And each of them needs a different ratio of the good bugs to the bad bugs in order for health to happen. So we know that the kinds of food you feed also promotes better quality bugs. Kibble tends to not promote the good bugs as much. Another reason not to feed a lot of carbohydrates. Carbohydrates also tend to be more pro-inflammatory, and we know that inflammation is a risk factor for cancer. So whatever we can do to lower inflammation in the body is a good thing in general. But looking at probiotics, a good strain of probiotics, looking at fiber. Fiber is a prebiotic, and one of the most amazing prebiotics and digestive health supplements one can use are mushrooms, medicinal mushrooms, because the mushrooms themselves contain this fiber, both the beta-glucan fiber, but also chitin. And those two fibers really nourish the good bugs in the bowel. And the chitin is a precursor to glucosamine. They get glucosamine for the joints from the skeletons of lobsters and crabs and shrimps and whatnot, because that is really rich in chitin. You can see how hard chitin is if you've ever tapped on a lobster shell or a crab shell. Well, the chitin converts in the bowel under the influence of bacteria into a type of glucosamine that actually helps to protect the bowel from these toxins. So mushrooms can be really good. Plus the beta-glucans in mushrooms help to improve the immune system in the bowel, which eliminates the bad bugs and promotes the good bugs. So there you go. You want to say something?
Can we talk about beta-glucan a little bit more? Like if you go to the health food store and look at beta-glucan, you got the 1,3 bond, 1,6 bond. And I know mushrooms also have D2, right? They also have a natural form of vitamin D in them.
I didn't go there with that, but yes, mushrooms, all mushrooms have something in them called ergosterol. It's a plant sterol, and it's almost identical to cholesterol, but it's the mushroom version of cholesterol. And if you expose ergosterol, just as if you expose cholesterol to ultraviolet light, it converts into the active dietary ingredient that is vitamin D2 for the ergosterol, or vitamin D3 for the cholesterol. So if you take a mushroom, let's take you buy some shiitake mushrooms at the supermarket, or maybe you're lucky enough to grow them in your backyard on a log, and you sit them out in the sunlight for 3 hours, maybe put the screen over them so the bugs don't get to them. That will increase the amount of vitamin D2 in them from like 400 international units to like 35,000 international units. Vitamin D2 is much safer than vitamin D3. You can use much higher dosages of it. It's not quite as potent as vitamin D3, but if you use a higher dosage, you can get the same benefits. So the company that I'm with, Real Mushrooms, we also cultivate the mushrooms, grow them ourselves. We're currently working on developing an organic vitamin D2 product derived from mushrooms, because you can't get organic vitamin D3. Do you know where vitamin D3 is made from?
Uh,
Sheep
oh
grease.
my God.
Sheep,
What?
sheep
Sheep,
grease, lanolin.
sheep grease.
But
Yes.
they actually take the wool and they drench it with like a solvent like alcohol to remove the lanolin, and then they convert the lanolin by exposing it to ultraviolet radiation into into the cholesterol, the cholesterol precursor to vitamin D3.
Which is kind of disgusting.
Well, it is, but I mean, by the time you get to the vitamin D3, it's just a purified vitamin. But if you're trying to sell organic mushroom vitamin D2, you tell people where the vitamin D3 comes from, and it's a sure sale.
It is a sure sell. So people want to know your approach to mushrooms, because do you rotate? Do you do prevention? Are you doing adaptogenic mushrooms? And I love the fact that you studied in the field, like you did botanical walk and talks. You learned about what it looked like to grow them and harvest them, things like that. You're just not a mushroom rep.
What?
A rep for the company. You actually understand how to grow, how to harvest.
Yeah, I'm not a sales rep. I'm the chief veterinary officer. I mean, I'm in charge of all the veterinary products and all the information, along with Joni Camlet, who who is just an awesome person to work with, just an awesome person to be around. And she's so much into mushrooms, it's infectious. But okay, so all mushrooms are adaptogens. Adaptogens are plants or mushrooms aren't plants, mushrooms, fungi that support the body through stress, and primarily works through the adrenal glands, which are our stress organ, and can help quite a bit in that regards. All mushrooms contain these beta glucans, and they call them the 1,3,1,6 linkages in mushrooms, and based on the types of linkages that we have with the beta glucans, the mushroom beta glucans can be very, very potent and can actually be directed to help with certain types of problems. Like, let's take turkey tail. Everybody talks about turkey tail because of the turkey tail studies for hemangiosarcoma in dogs. And turkey tail has been known historically over the centuries, or maybe in millennia, as being good for cancer, because initially it was tried and it worked, but over time that the oral tradition turned it into what we now know to be true. The reason why it's so good for cancer is it has the highest beta glucan content of any other mushroom, and it's not just the amount of beta glucans, because you could take more mushroom of another type of mushroom and get as much beta glucans as you would from turkey tail, but it's about the fact that it has about 10 different types of beta glucans. And so each one's a little different. They've got different molecules in them, different branching structures, and it's that which really gives the turkey tail some of its potency. There's another element in mushrooms called a terpene or triterpene, and those also have anti-cancer effects, and turkey tail also has the highest number of triterpenes. Well, maybe close, about the same as reishi. Reishi is very rich in these triterpenes. And so it's these mushroom elements that help to improve the immune system response to cancer. The beta glucans don't work directly on the cancer cells. They work indirectly. When they are ingested, they go down to the bowel, and they're taken in by cells that line the bowel that actually ingest the beta glucan. And they digest it inside, they process it, and then they travel because many of these immune cells are migratory, and they travel to the location in the body where the immune system needs to work, and then it spits out pieces of these beta glucans that are more active than the original beta glucans they ingested, so that they can activate other immune cells in that area. So you get the immune system is what is actually taking care of the cancer, not the beta glucans itself. So it's very interesting how that works, kind of indirectly through these.
Okay, so I know when my sister was fighting lymphoma, she was she's alive. Thank God. She had T-cell lymphoma, and registered nurse decided to go more holistic. So she did tons of Mataki fraction D and cat's claw. She actually created her own chemo. Like she took so much that her hair started falling out. I was like, what is going on here? I thought that was amazing. But I know Mataki used to be the it mushroom, and now it seems like turkey tail's the it mushroom.
Maitake is still a great mushroom. And
Nobody talks about it anymore.
well, some do, but it's and and the diffraction, it's a branded product, and they've done something different to the mushroom extract to be able to patent it, and sell it in that liquid format. There actually were several studies in dogs with lymphoma, or a study in dogs with lymphoma using that Maitake diffraction. And what they did first was they did cell cultures with different canine cancer cell types. So they used a connective tissue cancer, they used lymphoma, and I don't remember what the third one is, I apologize. Anyway, what they found was that it actually had the most activity against the lymphoma, so which was good information. They then took that, and it took about 10 years, but then another group of researchers published a study in the Journal of Veterinary Internal Medicine using the Maitake diffraction to treat canine lymphoma. Unfortunately, I think the study design was poor, because they chose dogs that had advanced cases of lymphoma. My experience with cancer, and you are so right, prevention's good, but early detection is also good. The earlier you can catch that cancer before it is, if you can get it in stage 1, you have a really good chance of eliminating it from the body if you follow, if you do the right things. By the time it's gotten to stage 4, where it's all around the body, it's in the lungs, it's almost impossible to do something with that, or to do something that's going to be curative. So they chose the wrong dogs for this. I was surprised, because it was like, why'd you do that? And then I checked the dosing that they used, because I've developed a dosing algorithm, a way to dose beta mushrooms based on their beta glucan content. And so what I do is I find studies where they tell me what the beta glucan content is of the test material, because not all studies do that. And then they give me the weights of the animals, or the test animals, the mice or whatever, or the humans. And then I figure out how many milligrams they used per kilogram of body weight, which is our standard dosing language, and see if it matches my dosing algorithm. One thing I like about the real mushroom extracts is that they analyze them all for their beta glucan content. So each bottle tells you what the minimum amount of beta glucans are that it contains. So this allows you to really dose it based on the beta glucan content. And the 3 tiers for dosing, there's the wellness tier. That's the lowest tier of all. That's basically for animals that are just that aren't really ill, but you just want to give them some preventative value.
Exactly. And then that was going to be one of my questions is, do you feed it as a preventative? And do you, like somebody in the chat asked, do you rotate them preventatively?
So I think that rather than rotating, you certainly can rotate them. I don't think there's a real need to it, because I think any one mushroom is really quite good. But we do know that when you group mushrooms together, when you give several at the same time, that there's a synergy, that they seem to work together better. So that's where you're seeing in the marketplace a lot of blends of 5 mushrooms, of 7 mushrooms, of 14 mushrooms, whatever it might be. So that's more what I would recommend in general. And certainly you can go ahead and rotate, but the body doesn't get tired of the same mushroom. You might want to add throw a different mushroom in, just to be different, to see if it's going to do any better. But we don't have any evidence that suggests that that really is something worthwhile doing. Using a blended formula, like Real Mushrooms has the 5 Defenders, which has reishi in it, which is just in my favorite mushroom, Ganoderma. It has turkey tail. It has chaga, which has been known to be great for treating cancer. Alexander Solzhenitsyn, the Nobel Prize for Literature, documented his fight with cancer using chaga mushroom in his book Cancer Ward. And he successfully treated it with that. It has maitake in it, by the way. So there is maitake still, because maitake is a great mushroom. And it's such a wonderful mushroom if you can find it. It's such a great edible mushroom. It's one of the most prized edible mushrooms there are. And I'll just digress a little bit, because I digress a lot. I hope it's okay. That in Asia, where you have people wildcrafting maitake, they gather it from the wild, and then they take it to the market to sell it. Families will pass on from one generation to the next the location of these secret areas where they always go to harvest their maitake, year after year, generation after generation. It's a well-kept secret, because the maitake as a edible mushroom is just so tasty and so valuable. And here in the U.S., it grows extensively, and if you find them, they grow at the base of the tree, like kind of by the on top of the roots, right by the bottom. I've seen some specimens 50 pounds of maitake mushroom. What a find that would be. You couldn't eat that all even in a week. What I would do is I would slice it up and dry it, because dried mushrooms are really the best way to preserve them. Otherwise, you might be able to keep them for a week or two in the fridge if they're fresh, but dried, they'll last for a long time, for years, and then you can just reconstitute them in an hour or two and cook them up. And I think dried mushrooms actually have more of a mushroomy taste than the fresh ones do, and I kind of like that.
So preventative, yeah.
Preventative, let me just say for a second. So preventative is a hard thing to prove. Okay, I think it's a good concept. And yes, I think for prevention, you want your body's immune system to be trained, by giving it these good things like beta glucans, enough that the immune system is already activated and already says, okay, there's nothing bothering you now, but just bring it on. I'm ready for it. We call that, actually, it's really a thing now. We call that training the immune system, just like training your muscles. And beta glucans are an important part of that. So yes, I believe strongly and embrace the idea of prevention. We just don't have any evidence. How do you do? You have to do population studies that last, for dogs, maybe 10 years. In humans, maybe 35 to 50 years to know if they work. There are a few of those types of epidemiological studies out there, mostly in humans, that do show a benefit if the humans take these mushrooms over a period of time. So yes, so prevention, mushrooms can be very good for prevention, but then we want to use them for intervention as well. And so a low dosage, like I'm talking about 2.5 milligrams per kilogram. Now a kilogram is 2.2 pounds. So if that's 2.5 milligrams, let's say it's about a milligram or so of beta glucan per pound per day. So you can divide that in different meals. You can feed it all at once. And that's a good wellness, maybe prevention dosage to use. Next step up, maybe you want to use reishi because it has, and maybe chaga too, because they have antihistaminic properties and you've got an allergic animal. So I would then use the next dosage tier, which would be like somewhere like about 5 mg per kg, which would be like 2.5 milligrams, 2 to 2.5 milligrams per pound per day. So it's twice as much as the wellness dosage about, and then when you start getting in, and another application for that moderate dosage might be if you're using, let's say, lion's mane, and reishi also for their calming properties, because they've got very strong calming properties. I'd go with that medium dosage to see if that was good enough. And then if it wasn't, you might want to add some more. But then the final dosage, the highest dosage, would be like 10 mg per kg, twice as much as the moderate one, but it can go as high as 30 mg per kg. I've seen some studies where I've done that reverse engineering of dosage, and it came out to like 29 mg per kg. So that's why I say 30. So that would be like 15 milligrams per pound body weight per day, which seems like a lot, but when you look at a real mushrooms product, like let's say half a teaspoon of their turkey tail would contain 300 milligrams of beta glucans. So 300 milligrams of beta glucans, if you divide that by 5, that's what, a 60-pound dog. So or a 60-kilogram dog or a 120-pound dog. So it's really not a lot. Half a teaspoon is not a much to add. It sounds like a lot, 30 mg per kg, but the actual physical product isn't that much to put in.
I think I fed too much to my dog. I have a 50-pound dog, and I think it was a little bit more than that.
No, it's safe to use them. They've done some studies. We don't have as much as we'd like to do, but we've seen some studies where they've given like really huge dosages of turkey tail to laboratory animals and saw absolutely no problems at all. And we know that to be a fact. Some pets might have an idiosyncratic reaction. Most commonly, we would see diarrhea at higher dosages. So, you'd kind of back off on that dosing until you get control of the diarrhea. Some patients can handle more than others, so you just have to be sensitive to that.
So on the 5 Defender, you're a big fan of synergistic multi-combo products, probably because it also includes their better bioavailability, because things seem to work better together, right?
I'm not sure I can speak to that knowledgeably. I think that in general, mushrooms, especially these mushroom extracts, are pretty well absorbed. Once they get in the bloodstream, the beta glucans don't get absorbed; they get kind of eaten up by the cells that line the bowel. So that's the other things like the triterpenes, which are fatty materials that absorb pretty well.
And you would purchase, I've used your 5 Defender. It smells like chocolate. Like, it almost freaked me out because it smelled so delicious. I was like, is there chocolate in this? I can't feed this to my dog. Can I? Like, I flipped the bag and I kept checking it. I went to the website. I'm like, there can't be chocolate in this.
It's chaga, I think, has that kind of taste.
Yeah, it just smells absolutely amazing.
Good stuff. And we have a lot of phone calls and emails from customers at Real Mushrooms, and I get to see some of those. And we hear from people, we hear about themselves, we hear about people about their pets, and 5 Defenders is the most popular product that we make and sell. And I've heard great things about 5 Defenders for allergies. I've heard great for helping to sleep at night. I've heard great for cancer. Now, these are all anecdotal. It's not proven studies with control groups and everything else, but I just think it says that those are 5 of the top mushrooms in terms of immune stimulation. So it's a good product. You just need to dose it high enough if you're treating a cancer patient. So your 50-pound dog is probably doing quite well for itself.
Yeah. Thank you. So on a critical cancer case, do you leave it that high long term? Do you pulse it? Do you swap it?
No, mushrooms are superfoods. So it's not like the drugs that we're thinking about doing, or it's not like some of the herbs that an animal might get used to or might have some potentially semi-toxic effects. They're foods. And so they can be given long term. They should be given long term. You don't expect to see something in 2 weeks. You might, but don't expect it. They need to be, on board for months really to have their best effect. My own dog, Ollie, he's got PTSD from his rescue deal. He was found at 4 months of age as a stray with a broken leg and dislocated hip. And even though he loves me and as a lab, he's so needy, wants to be with me, he's also scared of me. So I've been giving him lion's mane every day for a couple of months, and I'm starting to see him wanting to play with me more. I mean, it's subtle, and maybe it's the placebo effect, maybe it's my wishful thinking, but I do think that I'm seeing some improvement in him that way, which is nice to see because he's such a sweet guy.
That's exciting. Is that the picture on your,
That's all. Yeah,
yeah, what a pretty dog.
he is. He's cute. Mhm.
He is cute. So the doctrine of signatures.
Yes, the doctrine of signatures. This is how early people decided what things were for. They would see something that looks like a brain. They'd say, oh, this must be for the brain. They'd see something that looks like a kidney. They'd say, oh, this must be like the kidney. If they see like a cockle burr that has all those spikes on it, they go, oh, maybe this is for itchy skin, or they see a snake that sheds its skin. They use that shedded skin in some Chinese medicines for allergies. So yeah, so lion's mane looks like a brain. That's what it's for. Originally lion's mane was used traditionally, not just as a prized edible mushroom, but also for its benefit for the GI system. And it's only recently that we've learned that it also has these neurologic benefits.
I've been using lion's mane on my neuro horses to help support them.
What have you been finding with them?
I don't know, because it's been raining for months. And so I can't really tell. They're just frustrated.
How do you dose them, Poppy?
I usually, okay, this is really bad. I do an eye blink method. I would like shake the bag and go, that looks good.
Oh, eyeball. Okay.
Yes, I totally.
So why don't you try my dosing algorithm for a horse? And horses are very efficient
So horses are very efficient, and they actually use human doses in herbs.
I know. So let me finish.
Okay, because 1,200 pounds.
No, let me finish.
Okay.
So if you use the lowest dosing tier for the horse, 2.5 mg per kg, let's just for yucks say it's a 500 kilogram horse. I know that's only for 1,000 versus a 1,200, which is what, 545 or something, but it makes the math easier. Okay, so if we do 2.5 mgs per for 5 mg horse,
Oh no.
yeah, no, let me just get
Squirrel, we're having a squirrel moment. Sorry, you guys.
500 mgs times 500 kilograms times 2.5. Oops, 2.5 times 500. That's 1,250 milligrams. Okay, so let's say we're going to use the 5 defender. Well, your lion's mane. Okay, lion's mane is 25% beta glucan, so that'd be 250 milligrams per half teaspoon. So divided by 2.
And I'm probably doing like a half a tablespoon.
Right, and it would be a teaspoon.
Okay.
5 grams.
5 grams. Then that's not a lot. That's not bad.
Not. That's what I'm saying. And that even gives you some wiggle room to increase it if you're trying to, but you're already seeing an effect at that. That's why I'm shifting that algorithm down. I mean, the horses are the same with CBD. They're very sensitive to CBD, and they're very sensitive to fish oil even, they do a very good job of absorbing it, because when you think about what a horse is pastured on, where are they going to get their oils? They've got to be able to extract the plant oils as best as they can. And so they're very good at that.
Okay, we're getting back to dogs. Doctrine of signature. The reason why I brought that up is many mushrooms look like tumors. But when I look at turkey tail and reishi, I'm like, what does that look like?
Well, chaga looks like a tumor.
Oh, it looks like a hot mess of a tumor.
Well, it is. It's actually it's like a tree cancer or canker, they call it. But you don't. When the doctrine of signature works, Poppy, you use it. If it don't work, it doesn't fit. I don't think that the turkey tail grows on trees like a shelf, like a shelf bracket. I don't really think that looks like a cancer. I agree with you. Reishi doesn't look like a cancer. Turkey, maitake, maybe, I don't know. So, we use it when it's appropriate, but it certainly doesn't fit for every single mushroom.
Okay, because I was struggling with that.
Yeah, I mean, somehow early humans learned, probably through trial and error, which mushrooms were poisonous and which mushrooms were beneficial. And I have to believe that some of it was observational, but I also think that there was probably a much better developed sense of intuition and, kind of a third sense in early humans when they weren't as beleaguered by things like reading and media, and all the other things that I think kind of dumb us down and remove us from our ability to have that sixth sense that I think is so important for so many things.
I agree. I tell everybody the bigger my cell phone gets, the smaller my brain probably gets. So anyway, what about CBD? I always refer out because I don't feel qualified to talk about CBD. I've witnessed bad results in humans before, so I'm just like, okay, that's not my jam. Go call somebody else.
CBD can be very effective in horses and very helpful for a number of issues that we commonly see in the horse. The biggest thing, though, is when you're
let's do dog cancers. Yeah, let's focus on.
yeah. I thought you wanted me to talk about equine and CBD. I'm sorry.
No, let's do
CBD
this.
and dogs. Okay, fine.
Yeah. Let's do cancer and
no problem.
Perfect.
Yeah,
Thank you.
So CBD and THC and many of the other cannabinoids in the cannabis plant do have an anti-cancer properties that have been proven through a lot of studies and research. And what's interesting is that cells of the immune system have receptors on them for THC and CBD. And so when THC and CBD are given, they actually help to improve immune system function for whatever the need is. If the immune system needs to be increased, it increases it. If it needs to be decreased, it does that. But there also are these same receptors on tumor cells. And so when CBD and not all tumor cells, not all cancers are necessarily going to respond to cannabinoids, but when they do have these receptors on them and they bind to the tumor cell, then it causes changes within the tumor cell that ultimately can cascade it on the way to death. So we also know that not only can CBD and THC arrest the reproduction of the cancer cell, as we've proven, it also can prevent them from growing new blood vessels into it, because that angiogenesis of new blood vessels into the cancer are what feeds its growth as well, the blood coming in. It also has been shown to reduce the spread. It reduces metastasis as well. Carcinomas, that type of cancer, tends to be more sensitive than sarcomas to cannabinoids in general. I think lymphoma, which is considered to be a sarcoma, does have more susceptibility to it because these are immune cells that already have the receptors in them that have turned cancerous. And I've heard anecdotal reports of its benefit with cancer. We don't really have any studies yet using THC and CBD directly on humans or pets with cancer. We did have a study published last year where they again used these cell cultures of different cancer cell types. And what they found was that CBD, in fact, did arrest the growth of these cancer cells, but you have to give it at a really high dose. CBDA, which is the other ingredient that was in this product they tested, CBDA is the acidic form of CBD. It's present in the raw plant, but not in the heated plant. And CBDA is a stronger anti-inflammatory than CBD, but CBDA does not have an anti-cancer effect like CBD does.
Oh, wow.
So,
and so you have this whole apoptosis effect with CBD, but not CBDA.
And with THC, you also have that apoptosis effect. So when you're treating cancer, you're going to be, if you want to treat cancer with cannabinoids, the best way to treat it is with a blend of one part of THC and one part of CBD, and you give those both at the same time. And that gives you a double whammy, because the THC is very strong as an anti-neoplastic agent, and the CBD is as well. They also reduce inflammation and improve appetite and all those other good things. They probably can be used concurrently with chemotherapy without a problem.
So would you ever use it for preventative, I've run into clients that started their puppies on CBD because they wanted to do cancer prevention. I was like, I don't think it works like
Yeah,
that.
that doesn't really fit the science. I understand everybody has had bad experiences with the last pet that had cancer and they just want to do everything they can. And I think people get desperate. They get grasping at things that whatever they could do. Sometimes they just totally shotgun the whole thing. They read all kinds of stuff on Dr. Google, most of which isn't based in objective research or objective information. I don't think there's any evidence that CBD would be what I would use as a preventative, because the body produces its own natural CBD and its own natural THC. And we only really need the use of CBD and THC when we have problems with the body's production of our innate cannabinoids.
That's so fascinating. So as the body's being insulted and stressed, the natural cannabinoids are being diminished, depleted, and you're just replacing that.
Well, and there's other things that also can diminish the production of our natural cannabinoids. Even things, well, drugs can, viral infections. There's a number of, I've got a whole list of stuff, that can do that. So it's good that we have this plant now that we can use to help shore up our body's natural mechanisms to create what we call homeostasis. Homeostasis is balance in the body, and it's what helps the immune system to be more vigilant against cancer cells. Because as you say, we don't get cancer, we make it. And it's thought that cancer cells arise all the time in our bodies from mutations of healthy cells, and that our immune system, when it's competent, finds those cells, which are not normal cells, and kills them. But when the immune system is not working that well, or if the mutation rate is too great and it gets overwhelmed by too many cells, maybe exposure to carcinogens and toxins, maybe radiation. Here in Colorado, we've got a lot of radiation in the ground, and we can see that as a problem too. So
that's so fascinating. I'm a geek like that. Carrots have a natural radiation that people don't know about.
Tell me about that.
Well, I can't tell you a lot, but there's my naturopath that mentored me would always say, you don't need very many carrots because they have a natural level of radiation. But I wonder if it's because they grow in the ground and they're absorbing the radiation that way. Maybe they're nature's filtration system. So yeah, I was a junkie for carrot juice. In fact, I drank so much I turned myself orange, and then I was requested by my naturopath to back off of that. That was probably a bad idea.
Well, this will warm your nerdy heart. Carrots also contain a naturally occurring form of CBD.
Oh, I had no idea.
There's other plants that have molecules like CBD in them, not THC, and carrots are one of them.
That's amazing. So I was getting high off my carrots and turning orange all at the same time.
You were getting high off of your health.
Yeah, it was delicious. I abused it though. And I do love the fact that there are cannabinoids in a lot of different things, but you do need that 2-to-1 ratio of THC to your cannabinoid source.
I'm not sure what you mean.
So for it to have that 1-2 punch onto cancer cells and
1-to-1.
Okay, great.
But THC in dogs are super sensitive to the adverse effects of THC. They have a ton of receptors in their cerebellum, which makes them get ataxic and kind of weird if they get THC. Many of them go to the ER because it freaks their owners out. And sometimes, they might pick up an edible off of a coffee table that somebody, after you eat an edible, you kind of get forgetful about where you do things. And, a dog or a child could scarf it up and go right to the ER because they have taken a much larger dose. Edibles oftentimes can have larger doses. So,
and chocolate on top of that. So and then you've got your chocolate and your THC. So that's kind of a bad combo right there. That's
your pot brownies are definitely a problem. Yes.
Yeah. So yes, I know friends that give THC to their dogs sit there, drool. and look stoned out of their mind. And I'm like,
I think that's abusive to the animal, quite
thank
frankly.
you for letting me know that.
Blowing smoke in their nose and then sitting around and getting high and laughing as they stumble. That's not the way you want to treat a dog, you know? So dogs don't like to be high because dogs are all about survival. You know, animals are all about survival. And when they're high, they're out of balance. They can't hear well. They don't see right. It freaks them out because they don't have the ability to survive or to fight, or, to flee or whatever it might be. I don't think it's good to give dogs THC unless it's something that they really need because they have a lot of pain, or you want to get them onto cancer. But if you're going to get them onto THC, there's a process you have to use, because if you give the dog a teeny amount of THC every day, a little more than what we find in full spectrum hemp products, but a little more, but not so much. So that's why maybe using a ratio product that has 20 parts CBD to 1 part THC can be a good way to get them started, because once they've had small amounts of THC for about a week, they become tolerant to those adverse effects that I was showing you. They get sleepy from it, but that's all. So then after you've got them conditioned and tolerant to THC, then you can start to gradually increase it every week, increase it by maybe a tenth, or a tenth of a percent or something. And until you can get a good effect with that.
So I've always thought of cannabis being like end of life management, but it seems to be more useful than quality of life, end of life management, because I always like tell my clients, once you're kind of on the cannabis, you might be on it for the rest of your dog's life. Like I always try to look for other stuff. Unless we're battling cancer, and then I recommend them to go to somebody else for that advising, because I just feel like, okay, once you're on it, unless it's actually curing something, you're just managing something. Can you?
Actually, there's another piece to that too, Poppy. If the cannabinoids actually cause the cancer to go into remission, and they can, and I'm good friends with an oncologist who. A veterinary oncologist who will use that, or not recommend it, but people will come in with it, and then she'll help them adjust the dosage and stuff, because it's a Schedule 1. It's still kind of sketchy for a veterinarian to recommend it, because you're recommending something that's illegal that causes our license to come into question. I'm still licensed even though I'm not practicing, and she has told me that when the dogs go into remission, if they stop giving the cannabinoids, the cancer comes back. And when it comes back, and they try to start up the cannabinoids again, they don't work. So if you see success, stick with it,
Yeah, that's been my experience too, is where clients see the tumors go away with the protocol, they totally stop everything, comes back with vengeance, and it's built an immunity to your previous protocol. So good to know.
Good to get the word out about that, because I'm sure there's people who are listening who that may wind up becoming something they'll need to know at some point in their pet's journey,
Absolutely. You guys, do you have any questions for Dr. Rob? We have gone an hour already, Dr. Rob.
My time flies when you're having fun.
So Colleen's asking, is THC okay for dogs to have? And we talked about that. I was told it recycles through the liver multiple times. Is there a liver harm to THC?
There isn't at standard dosages. The liver does detoxify the THC as it does the CBD. There can be an interaction between the CBD and the THC to compete for liver sites for detoxifying. But I'm not quite sure what they mean by it goes through the liver several times. There's something called the enterohepatic circulation, which works through the bile, and maybe that's what they're referring to, that it detoxifies it and then it goes through the bowel and then gets recirculated until it gets fully detoxified.
That makes sense.
Yeah, but it doesn't harm the liver, no.
Okay, good to know. Any negative that we need to know about?
Well, THC, first of all, when you're talking about using a cannabinoid product for a pet, you want to be sure that you're getting a product that has good quality control. Most importantly, we want to know that the amount that it says it has on it is what it has in it. And if it's a full spectrum hemp product, which would have THC in it, we want to know that the level of THC matches the legal requirements for hemp, which would be less than 0.3% THC present in that formula. So when we've seen bad results from products that people are using, getting somewhere, even the internet, although now I see people kind of selling it on roadside stands and in gas stations and stuff. You're taking a risk unless you know that it comes from a reputable supplier. I suggest to people that they call the company and they say, can you please give me the certificate of analysis? This is the laboratory analysis for that product that would show what contaminants it might contain, like heavy metals, or pesticides, or solvent residues, or mycotoxins. But you also want it to show you what it has in it. How much CBD does it have in it by analysis? How much THC does it have? Because you want to make sure that the product is what it says it is, so you can use it according to the amounts of the active ingredients it has in it.
So how do we find quality products?
Well,
Did I put you under? Is this
no,
a bad time?
when I'm giving, I know that everybody's into marketing these days and these
Right.
podcasts and everything. Everybody does marketing. That's fine. And I just want people to know that the information I'm giving is pure information. I'm not trying to sell something, but I have my own brand. I have my own product line of CBD products, and I follow all the rules I tell people to follow and can provide certificates of analysis and everything else that they want. I've got 2 different tincture sizes. I call one silver. I call my product brand Doc Silver Naturals. I call my more potent product the Silver Bullet, and it contains both CBD and CBG in it in a 2-to-1 ratio. And I think the CBG is much more potent than the CBD. And so we're getting very good results with this. The less potent one that would be more for small dogs and cats, I call Sterling Silver. And it's got about a 25% of the potency of the Silver Bullet. And then I've got 3 soft chews, and I've got Silver Dog chews, which have CBD and CBG in them, 6 milligrams of the CBD per chew, but it also has lion's mane and it has cordyceps as well. Lion's mane is good for focus and for memory and for settling a little bit, and the cordyceps is good for energy. So it's a good general blend of 2 mushrooms that have similar but different properties to kind of help give some benefit to the animal. The CBD CBG can help with mobility issues. The cordyceps can give stamina for performance, and the lion's mane gives focus. So I took that and made smaller little chews I call rehab helpers. And they're meant to be given for dogs as kind of training treats that also have some function to them. So you can take them for a hike and don't worry about giving them too many. They're so tasty because they're such a low dosage. You can give quite a few and the animal will be fine with them. And then I've got silver cat chews, which are the same size, actually the same thing as the rehab helpers for cats. And they're on my WellPet dispensary if people want to find them. And I don't know if you're offering any kind of a discount coupon, but I can give you something that you can put up later if you like, if I didn't give you one already.
Yeah, you actually did give us a discount. So I'll put it in the live feed, you guys, when we wrap this up. Dr. Rob, CBG? What is that? I've never even heard of CBG.
CBG is another cannabinoid that's found in the plant. And it actually is the first cannabinoid that the plant produces. And then it takes the CBG and either makes CBD out of it or THC. So it has properties of both, but it's not psychoactive. And when they do studies of the anti-inflammatory ability of CBD, and they compare it to CBDA, as I mentioned earlier, the raw CBD, or CBG, they're both like 10 to 20 times stronger than CBD. CBDA, it's not very tasty, but CBG, you can't taste it at all. So that's why I chose to put CBG in there, because if an animal won't take it, it doesn't work. I think the most important thing with an animal product is palatability, even before safety and effectiveness, because if they won't take it, what's the point?
Yeah, you just don't want to be cramming that down your animal's throat and having them resent you.
To make it easy. And we know now with CBD, with the oil, that it actually is better absorbed if you give it with a small amount of food. You don't have to chase them down and stuff it, and try to squirt it under their tongue or anything. They won't get as good absorption as if you just put it in a little bit of food before you feed them their meal. The best food is fatty food. So I recommend canned cat food, the ideal fatty food for a dog.
Oh my
Just
God.
a tablespoon, mix it in with the cat food and give that to them, and then they can have their regular meal. And it increases blood levels 5 times over doing it sublingually. And it makes it easier to give to them.
So this is like an hors d'oeuvre. You're doing this as like a canine kitty hors d'oeuvre. Could you mix it with MCT oil?
Yes, absolutely.
Okay, so you could maybe do MCT oil in that, maybe in some raw milk. I always do like a little hors d'oeuvre for my dog with raw milk because I think it coats the stomach and sets up the microbiome.
Milk is good. It's got good fat to it. Now, the Silver Bullet and all of those, they use MCT as their vehicle, so they're already in MCT. But you're just not, you might only be giving a quarter of a milliliter. So yeah, more fat would be good.
And MCT might have an anti-cancer aspect to it too, so you might get kind of a triple whammy on that. Now on cats, cats are really difficult to get them to eat things. So what I do is I put a little bit on their paw. And so cats love to lick things off of them. Plus they get the availability through their skin.
Yeah, I that's okay. The sterling silver is incredibly bland. It just tastes like MCT. So some cats don't like texture, even if if the taste is okay. So that might be a situation, but I would just blend it in with their canned food, and the thing with cats in terms of getting them to take things is cats are very careful about taking in something they haven't taken in before. If you ever feed a dog, they run up to the bowl, they don't even sniff it, they gulp it down and run away, whatever.
I doubt they even taste it half the time.
Every day you feed them the same food in the same bowl, the same time, same location, they still sniff it before they eat it. This is because they're making sure that the nose, the olfactory apparatus is very good chemical analysis laboratory. It can tell if there's something new in there that they didn't sniff yesterday. So when there's something new in there, they get very suspicious of it, especially if it smells like something they've never tasted before. So I recommend with cats, you just start with 1 drop, with a tiny amount, not enough to really overwhelm the taste or the smell. And then once they get used to that 1 drop, then you gradually start to increase it until you get to the optimal dosage. With cats, they're not going to take much more than a quarter of a milliliter.
Okay.
At the most, a half a milliliter, which might be 4 to 8 drops, possibly, maybe 10 to 12 drops.
Good to know. That's exciting. Thank you for sharing all your wisdom with us.
I'm happy to.
I appreciate it. Anybody here on the Zoom, if you guys have questions, go ahead and bring your video up and unmute yourself. I see that Christina was asking about hemp CBD versus the cannabis.
So the thing about CBD period is really what I said. You don't want it to have more THC in it than hemp, than what is legally recommended in hemp. I actually don't recommend full spectrum products for dogs because of their sensitivity. I don't think you need the THC, which I know is going to shock a lot of people that are, that love THC, because, people like THC because they know they can feel it. They know it has an effect. CBD, you don't always feel it, but because dogs have such a strong reaction, and some dogs, you don't know how sensitive they are. So for a product line, I didn't want to put THC in it because I don't want people to have problems. If you really want to use THC to get some results in a pet, you need to go to your dispensary and get dispensary level THC. And then you need to be able to dilute it so you can control the amount you're giving. if you can get an analysis of how much CBD is in a dispensary cannabis CBD product, then you can use that intelligently. But most of the time, there's really not that kind of quality control with these state-run dispensaries. Eventually, when it goes federally legal and some of the federal regulatory agencies get involved, then we might have better quality control and better consistency of products.
Somebody's asking in the chat, do you just feed the human real mushroom products or do you buy the pet products?
Well, right now, what I've done to make pet products is I've taken the human products and I put them into smaller capsules. We discussed whether we would make pouches for pets and label them, but there's no difference between that and the human pouches. And we felt that it was a bit misleading to the consumer. So you can certainly, yes, use the human labeled products for your pets. You can use my dosing recommendations for those because they're all the same. They all have the same beta glucan content. What I'm doing is creating additional products, and we have the first one coming out in about 2 or 3 months. We've just finally found a manufacturer that can do what I want them to do. These are going to be powders that you would scoop on, like toppers for the food that you would just put on the food. The first one is going to be a daily preventative, so to speak. It'll have everything in it, even probiotics. And it'll have 7 different mushroom extracts in it, as well as beta glucans from seaweed, which is really potent as well. And then I'll be having some other ones. I'm going to be doing one that'll be just a lion's mane and cordyceps powder, because that combination turns out to be really good for things it's not bad for immune system, but it's good for behavior, good for some internal medicine things, good for horses. In a pouch, you can give a small amount to cats. Those are the 2 mushrooms that cats are most likely to take. And then I'm going to do one for canine cognitive disorder. I'm going to do one for allergies. I've got all these condition-specific ones that will be labeled specifically for pets. And I think that will give the consumer better choices, but it just didn't make sense to duplicate the human products. It just seemed like a waste of money and a waste of time when we already have those products and they have great reputation.
So if people want to order, they go to the wellpetdispensary.com. Correct.
I do sell the real mushrooms products on my website as well. You might find a better discount or deal, if you go directly to real mushrooms. I don't care where you get them, just get them. They're good. I think it's convenient if you're going to be getting other things from my website to, add the mushrooms on. That's why I have them. But, check it out, see what works for your budget and what works for your convenience level.
Now all the questions are rolling in, Dr. Rob. I'm super sorry about this. So Kathleen says she used FECO oil for suppositories with an anal gland cancer. Do you have any thoughts?
Well, that's supposed to be that's basically what they now call Rick Simpson oil, I guess, put into a suppository. We find that that they have to do some kind of chemical modification of suppository in order to improve absorption. But because you're not really wanting to get into the systemic circulation with anal gland tumors, you're really just wanting it to absorb locally, I think it's a good idea. But the concern is that there might be enough THC absorbed to create an adverse effect. But other than that, that's not a bad strategy to use. Those could be pretty nasty tumors.
And can you talk about tremella?
I can. Tremella is snow fungus. It's a prized edible mushroom in China. And one of the neat things about tremella, other than its taste is totally bland, is it has some benefits very similar to lion's mane for the nervous system, but it also has a hyaluronic acid-like compound in it, which helps to moisturize. So a lot of people are using it for their complexion, for cosmetics, topically and orally. And for dogs, I think it would have a similar benefit. It certainly will be in my allergy formula, along with reishi and chaga.
It could be a bulldog facelift mix. I'm joking.
Yeah, especially if it's a Shar-Pei, right?
The older I get, the more wrinkled I buy dogs, just to make myself look better. Sorry. And then Hayo is saying CBD is very popular in epileptic dogs. Unfortunately, it seems to trigger seizures in some dogs. Why is that?
I don't know why. I think every dog's an individual. THC has been known to trigger seizures. So that's why I also would recommend a broad spectrum with an epileptic dog, because with a broad spectrum, you could be certain that you're not getting too much THC if there's a misanalysis or mismanufacturing or something. And I think when you introduce it, I think everybody's very eager to get as high a dosage as you can to stop those damn seizures, because they're awful, you know. But I think you really need to start very slowly, even with CBD, because sometimes just trying something different for an epileptic can precipitate a seizure. You know, different food, different pattern of the day. You come home later. It's all those things. They, depending on the animal and the type of epilepsy they have. So I suggest starting with a little bit, a drop or two, and again gradually over a couple of weeks build it up to the starting dosage. But with CBD, you don't know. Oftentimes these seizures go on cycles, 3 weeks, 4 weeks, sometimes even correlated to the moon, the phases of the moon.
That's what I was just going to say. Are they parasite induced if they are in cycles with the moon?
I'm not really familiar with the theory that epilepsy comes from parasites. We can talk about that maybe another time. But
Yeah.
But what I'm saying is that when you dose for seizures, you don't know if it's working until you go through that 3-week cycle or 4-week cycle. So when I recommend CBD and other stuff for seizures, I say, let's start here, okay? And let's see let's wait till the next seizure event and let's see how it changes. Is it less? Are you fewer cluster seizures? Is it not as long? Do they not urinate on themselves? Whatever it might be. And if you're not seeing that, then we increase the dosage and then wait another 30 days or so till the next seizure. And we use that as our way of empirically deciding to increase the amount that's being given. Right now, there's a study on CBD with seizures in dogs that's using a dosage nearly 5 milligrams per kilogram twice daily. And that's quite a bit and could be quite costly as well if you've got a large dog. But there's nothing worse than these seizures that are not responsive to seizure medication. We call them treatment-resistant seizures, and it's awful. The dog's a walking zombie. It's on all these drugs that are totally gorked it out, and it still has seizures. And so that's why we're hoping that we can find that CBD can be a partner, if not to eliminate them, to reduce them and make them less awful, less yucky.
I was wondering if it's because maybe there's pesticides or the growing practices aren't so ethical that maybe they're spraying it with something.
Well, that's why having that certificate of analysis before you choose a product is very important, because they should also have, pesticides and herbicides on that as well. So
Perfect.
So if it's done right.
Okay, you guys, one last question. Natalie says her dog is 72 to 73 pounds and she wants a bigger package in the future because to give her dog silver dog chews, and there's 30 in the bag, it won't last a week. Will you make a bigger bag?
So here's my thinking on that. Good point, Natalie. And I need to put that into action. They're brand new. We've just gotten them on board. I've got so many things I'm doing. The idea of going back to doing different promotions with the website, it just takes time. So I like that there's only 30 chews per bag because it keeps them fresher. And when I was selling them in 60 chew tubs, like I've got behind me there, oftentimes by the time you're done, you keep opening it and closing it. They're hard and they're hard. So my thinking would be to offer, like a bundle and give you a discount, like maybe offer 3 at a time and then give you a pretty nice discount if you buy 3 at one time. So obviously I need to do that. So that will be on my agenda to get that promotion set up here. But thank you. That was a good reminder that I haven't done that yet.
Right on. Thank you, Natalie, for asking that.
And Natalie, if you want to reach out through the contact form on my website and identify yourself, I'll just give you a discount that will help you with your next purchase so that you can use them. Yeah, it's a new, I redesigned them. You know, I added the mushrooms to them. I added a couple of an extra flavor into that, which makes it very, very appealing. And I was worried that cats wouldn't eat it, but I've heard now from a couple of people that they do seem to be attractive to most cats. Now, I have a cat. She won't touch it.
It's for cats.
Drives me crazy. She won't touch it. She eats my relaxed mushroom chews that have reishi and lion's mane and tryptophan in them, but she won't touch my silver cat chews.
She just knows she needs to chill out more. So how do people get a hold of you?
Well, the best way, I think, in terms of directly would be really through the contact form on the website.
Okay.
I check it every day. I try to do my best in answering questions. You know, obviously I can't give medical advice, you know, without a doctor-patient relationship, but I give product advice, and I also make suggestions as far as other things that we don't have on the website that might be helpful for the pet. I try to suggest local veterinarians, you know, if there is one that can help you directly, because, you know, I'm just me. I think you need somebody who's hands-on. And, you know, and then I can also, you know, yeah, so that's the best place. So that would be wellpetdispensary.com is my website. And then it's just, there's contact form buttons everywhere. Probably the footer is a good place. The bottom of the page oftentimes has that contact us. And then you have and then it brings up the email address to us, and you just write away, and I'll do my best to answer it.
Right on. Thank you so much for your time. We're going to see you again on Monday on the Holistic Animal Insights page, and we're going to talk more about horses and all sorts of things.
Is this coming Monday?
Yeah,
Right?
hopefully.
Well, those atmospheric rivers won't wash you away.
If it happens, it happens, but hopefully not. We'll see. We'll see. We've had way more wet days than dry days since 2023. It's amazing out here in California, but we're almost out of drought, so that's good.
Yeah, at least for now.
Yeah, at least for now. There's a lot of people that need a lot of water here in California. So, Dr. Rob, thank you. You're a wealth of knowledge. Wow, it's just awesome. I've learned so much today. Thank you.
It's been fun. Thank you.
Right on. See you soon. Bye.